Health Watch Oklahoma is on the air, and you know what that means. It's time to see somebody we haven't seen. I mean, I think he's been traveling around the world and having all kinds of adventures. But people have been going, you know, I saw a friend of mine said, I saw Dr. Bookman's face on a milk carton the other day. Yeah. But you have to understand. Hi, I'm Scott Mitchell. This is Dr. Larry Bookman, MD. You know, you got to be old person to understand that joke, right?
Yeah, yeah, you really do. And I will say, while I was traveling, I was not enjoying all of it. So, for those who don't know, I had to isolate while out of the country because of testing positive for COVID. Was not sick, taking the vaccine, taking the boosters. I had virtually no symptoms, never felt bad, but tested positive, and at that point, you couldn't come back into the United States. So we got to sit in a hotel room for 8 days. Not the way I would have liked to have spent those 8 days, but I'm glad to be home.
I'm glad you're home, and I'm glad Mrs. Bookman's better.
Yes.
Here's the thing, though: if you're going to get like someplace off, get stuck in a hotel in Switzerland. I mean, ain't that the way to do it?
Yeah. It was a nice place to be, overlooking the Rhine River, and the people were very nice to us. And I'm very happy the president has done away with the rule that you have to test before you come home. Now all of us can come home without testing positive. So glad to be back.
Let's introduce our guest here, Dr. Bookman. They're waiting. They've been waiting for. I know Representative McEntire's been waiting for 6 weeks. He's like every day calling me up and going, "When's Dr. Bookman back? We got to get this show done."
Bring him on.
Hello, Representative Marcus McEntire. I'll unmute everybody. And Dr. David Holden, MD, the current president of the Oklahoma State Medical Association. You guys, it's good. Let's just do this. We should make them feel welcome. Yeah. And I will tell you, we have a couple of sound bites for you. Dr. Bookman, I'll be backstage. I've got them done. I have a bite from the speaker from today and from Senator Thompson from yesterday. I've almost got them loaded. I'll have them loaded in 2 or 3 minutes when you're ready to get to it. So give me 15 minutes. I want to welcome our audience. Looks great tonight. Holy cow. And I look at that upper left-hand corner. Thanks to Ryan Welton. We've cross-posted, got a great audience tonight. And I'm looking forward to this because I saw Representative McEntire at Pete Reed's Veterans Force 50 deal the other day, and I said, "Man, we got a lot of questions for you." So, Dr. Bookman, let's start those questions. Take it away.
All righty. We're actually going to start tonight, and I did give Representative McEntire warning. We are going to talk about some issues that are medically related and very important to the people of Oklahoma. But I want to start off talking about what is happening in the state legislature. The governor called the legislature back, for those who don't know, for emergency session to try to get some inflationary relief, decreasing grocery tax, decreasing personal income tax. The House very quickly passed, and as I understand, sent 8 or 9 different bills options to the Senate. And basically the Senate has called this political folly, political theater, and is not going to hear any of those bills, and adjourned today before they even received them. So there seems to be some differences between the House and the Senate. What's going on, Representative?
Well, let's go back to the regular session first. Now, let me tell you, for all your viewers or listeners or whatever, I'm a pretty fair person, so I'm going to try to give you the most unbiased that I can, what I think might be going on. So this goes back to last session, the one that we just ended. The House was under McCall's leadership. He introduced a number of inflation relief bills, and it was one of our priorities going in that we would probably have to do this. And so the House was very eager. We passed almost all of these proposals that we basically just reran in this special session. We passed all of those, and the Senate did not hear them. And so the Senate has been very consistent that they didn't have an appetite for tax cuts and things like that. So they didn't hear any of those bills. They did hear a few, the auto tax that the governor vetoed, and the other bill, I can't remember what it was, but he vetoed both of those. So here we are in special session. The governor calls us in and says, I want tax relief. Well, he's talking the House's language there. And so you have this triumvirate. You've got the governor and the House and the Senate, and three kids rarely play nicely together. They usually gang up and leave one out. And in this case, the House looks like they've teamed up with the governor and answered the call in the way he wanted. And the House gave 9 different options to the Senate. They adjourned. We adjourned sine die, but we have left our clerk's desk open. So if they want to come back, they could come back and hear some of those bills. But the question in my mind is, why won't the Senate hear these bills?
And that's the question really that all of us are asking. Why isn't the leadership of the Senate at least debating these bills instead of literally not hearing them? And in fairness to them, they say they want to form a committee to research. And I understand we had tax reform last session. We did get a decrease in personal income tax. The other bill that the governor vetoed was the $75 across the board rebate for all taxpayers. And I can understand that. It probably ought to be based on some criteria. But at this point, all Oklahomans do need some relief. Inflation is hurting all of us, our farmers, everybody. It doesn't matter who you are. Inflation's hurting. And a big part of our gasoline per gallon is taxes. And if we can decrease those, we help everybody. We help our farmers who are using hundreds to thousands of gallons. We help the city workers who have to drive, some of them 20, 30 miles to work or more. So everybody gets relief, at least on personal income tax and on gasoline tax and on grocery tax. So those three, I think, should be no-brainers. Scott's got some sound bites that I'm going to let him play, and then we'll get back to this. And I don't want to spend the whole program on this, but I'd like the people to understand what's going on with our legislature.
All right,
Scott,
so
go
let
ahead.
me set this up, and then I'll get in and out of this real quick. So the House has issued a press release that came out a couple of hours ago, where it was on McEntire, and this is from the Speaker, who said, the Senate has spent all its time this week finding reasons not to help Oklahomans with inflation. Anyway, and also my friend Eccles has weighed in here. He said the bottom line of the Senate was passing bills instead of fabricating false legal excuses. Oklahomans could stop paying state sales tax on groceries come July 1. And then they listed the bills that passed today. So yesterday I had some time, and you could go to News 9, News on 6 right now, any of their platforms. You can see the entire interview with Senator Thompson, who's the A and B chief over in the Senate. So I was asking him, this was less than 24 hours ago, about the operating philosophy over in the state Senate. Let me start with Senator Thompson, and then I'll get to what we learned from an exclusive I had this afternoon with the Speaker. So here's Senator Thompson and ask about what they're going to be doing in general with things that are coming over from the House.
Well, as far as the special session goes on the tax cuts, in the Senate, we're wanting reform. Let's talk about what taxes we can get rid of, what taxes we can replace that with if we need to. Can we actually lower our tax base out to the citizens, but broaden that base? And so we're more interested in not just throwing something at the wall and see what sticks, but what's really good for the state of Oklahoma in the long run. And so at this particular time, there is no interest on our part of just having a bill that has not gone through a committee process. No one's talked about. They don't know how to implement it, and just run that off of the floor and throw it over here and throw it on our floor and vote on it and say, hey, that's what we're going to do for the people of Oklahoma. That's not our plan. That's not where we're moving forward. Pro Tem Treat's doing a great job of organizing a committee to look at this. He was very articulate and early on in simply saying that we want to do something good for Oklahoma. And I'd like to remind the viewers that we did last year. We cut the income tax by a quarter of a point. That's yet to be fully realized in the state. Corporate tax was cut last year. The restoration of the earned income tax credit last year. The Senate also this year honored a promise. We told the people back in 2017 that we're going to, add 1.25% to the vehicle tax. We need it, and when we have the money, we'll take it away. It was part of our budget deal this year. Both bodies passed it. The governor vetoed it. The Senate overrode that veto because that's real relief out to the people of Oklahoma. So we want to do what makes a difference, not what makes a statement.
Well, there's you a sound bite, huh? Okay. So, and to hurriedly get my point made so I can get out of everybody's way, this afternoon, or it was earlier today, I had this exchange with Speaker McCall, who, by the way, only appears on Mitchell Talks programs exclusively. Little promotions right there. So here's the speaker. He's, as is his style, he's going to get into the weeds here. This is about a 3-minute bite, but he's explaining what the House is trying to do.
And Scott, we first and foremost, we're not just responding to the governor's call for special session. These issues are ones that were discussed in regular session this year. The House actually passed them. And because we know the people of the state of Oklahoma are dealing with inflationary problems. Everything is more expensive, and even the basic necessities of life are more expensive when you go to the grocery store. And so the House is these measures that the House are voting on today and moving forward to the Senate. We have in the House, we've already had fully vetted these issues. We know that the personal income tax will put more money in people's pockets to help them combat inflation that they're experiencing, and whether that's at the gas pump or at the dry goods store, at the hardware store, wherever that may be. And we know that the grocery tax will give some relief to those for the commodity purchases and groceries that have been escalating over the last several months. I mean, we are seeing inflation at a 40-year high. The House of Representatives is the chamber closest to the people. We are always going to respond immediately, and we are moving multiple versions of both the income tax cut and the grocery tax cut to the Senate. We are going to push relief, get those out of the House over to the Senate, and they can finish the process on those, and they can decide, Scott, how fast they want to move them forward, and they have processes just like the House does. We're fortunate in the House to have done a lot of work already the last 4 months of this year on these issues, and we don't need to spend any more time looking at them. But we understand where the Senate is in terms of their processes. That's why we're going to send them variations of the same issue. So on the personal income tax, Scott, we're sending them a 2-year moratorium on a quarter cent reduction, a reprieve basically for 2 years on an additional 0.25% tax cut. That would be in addition to the one that's already going into effect this year that we passed last year. So that would, if this one makes it through the full process, you would see a full 0.5% effectively reduced for the people of the state. In addition to that, we have a permanent quarter cut rather than just a 2-year reprieve on a quarter. Last year's cut was permanent. The Senate will be able to decide whether they want another full quarter permanent cut or if this next quarter cut, they want to do it on a 2-year basis, and then take a look at what the state's revenues and fiscal picture look like at that time.
Pretty clear. There's different variations about how they want to go. Representative McEntire, which he is from the House that is closest to the people. So it's Representative McEntire, man of the people. So
I listened to both of those, and they both are right. Okay. I mean, the Senate wants to make they're making a prudent policy decision, but the House, who is closer to the people, see that, look, we don't have time. We don't have a lot of time. But the Senate is like, whoa. I mean, they're doing the way this whole system was designed. And the Senate's like, whoa, simmer down, House. We need to make sure what you want to do is prudent. So we want to have a serious, I think Pro Tem Treat said, we want to have a serious, mature discussion about tax reform. Well, I would argue that they're making a political mistake here, because we don't have time at this point to talk about real reform. We can talk about that while we address some of the needs that people are feeling. And people are texting me and emailing me every day saying, gas is $5 a gallon. I just bought a motorcycle because my car's too expensive to drive. One guy was having a problem getting his permit for the motorcycle. But I mean, people are like, we need some help. The problem is that Oklahoma taxes, we really tax very low. So any tax that we give in the form of income tax, I mean, if you make $100,000 a year, you're going to get like $250 back, or $400 back, $450 or $400 back. And it just is not that meaningful in the grand scheme of things. But if we look at how much it costs, it may be $190 to $200 million less revenue in the state for us to take care of the needs of the people. So should I dare say that they're both right? But I think that the Senate is miscalculating politically on this, and I think it may hurt them a little.
Yeah, and I think it's important to note that they were given options, and some of these are 2-year moratoriums, as was stated, so that it's not a permanent relief. And we do have, I think it's stated that we have $2 billion in our rainy day fund. So, I think people need to understand that, and need to understand what's happening in the legislature.
Well, 2 years of downtime, Dr. Bookman, 2 years, like it happened in 2016, 2 years of the oil and gas going way down, and us suffering, which looks like we're headed that way. Perhaps another recession. I don't want to say that out loud very much, but if that happens, we will deplete that $2 billion really fast. So.
Yeah. So, I mean, at least they could even say 1 year. I mean, there are options.
They're temporary. Mm-hmm.
Yeah. What I want to go to from here is sort of segue off of what you said. And yes, we're spending money. We had over 200,000 more Medicaid, and the legislature, House and Senate, passed managed Medicaid, something that you and I have discussed on air and off air multiple times. I want to stress to the people that this does not affect Medicare, and it does not affect private insurance. This is Medicaid that we're talking about. But 60% of Oklahoma children are born under Medicaid. We're talking about a lot of Oklahomans who are going to be affected. Can you tell us why managed Medicaid was passed, what you think the advantages now are in that system, the way it's planned?
Why it was passed? Well, sorry, my dog is dragging his bone all over the place.
That's okay.
Yeah, why it was passed. I'm not a huge fan of managed care at all. I think it gets between the doctor and the patient, an insurance company as an intermediary. I don't like it. I don't think it's a good business principle, or or excuse me, good. It's probably a great business principle, but it's not a very good health principle. And I just was not on that team. And but then, I mean, the governor really wanted to see this happen. He's been pushing for it. We've the House and the Senate have fought him off for 2 or 3 years, and we had a plan that would bring a bunch of money into the state. This managed Medicaid is going to bring in. It's bigger than Ocean. It's going to bring in $800 million to $1 billion a year into our healthcare system. Now, most of that money is going to flow through hospital systems, but there was a way to do it, and everybody, well, not everybody, most kind of lined up behind it, and the governor wanted it, and so we ended up giving him what he wanted. But to do so, we had to pretty much pay for it.
David, from OSMA's standpoint on managed Medicaid, they've never been behind it before. We have a past history in the 90s with managed Medicaid that was a real disaster. What is OSMA's viewpoint on this?
Well, let me just say that I think you remember we were talking to Senator Paul Rosino, and he said doctors are against everything. That's your reputation. And I go, well, that may not be a bad thing, depending on what's coming around. Philosophically, all physicians are against managed delivery systems because of the word managed. By definition, they have to get in between, as Representative said, the doctor-patient relationship. Managed care was created for one reason only: to cut costs, to manage costs. I've been around almost long enough to know before it existed, and that's the reason. No matter what they say, that's what it's for. Now, they'll say, the proponents will say, well, it delivers better care. We can improve outcomes and results, and that's the carrot to go along with the stick. The problem is that's very difficult to do. And in the end, it's all about controlling costs. And this money, as the representative said, is coming from the federal government. It was tied to making this a managed care delivery system, or to get that money. We in OSMA actually sued and won in the Supreme Court when the governor tried to do this outside of the legislature, which was they ruled unconstitutional. So, of course, that fell through. Now, properly, I mean, the healthcare authority went to the legislature and said, we still want to get this done. Let's do it the right way, and we'll submit a bill. And that's what they did. Now, where OSMA, and again, has some issues is how it was done, because we had very little say or input into the documents until they were almost, a couple of days before before the House voted. And we did meet. Representative McEntire and I met, and we kind of discussed it out there with the secretary, and hashed out the issues. And the bottom line is, I understand it. The OSMA understands it. You can't turn this money down. It's just hard to turn it down. And the issue going forward is going to be, and has always been, for me as a physician, and I, again, as a president, I'm looking out for physicians. And this has absolutely nothing to do with a physician's income. What it has to do with the physician's ability to deliver that health care. And under Medicaid rates, it is very difficult for any physician to deliver the care because we simply can't afford the staff. We can't cover the overhead. So therein lies the issue. The system is going to be difficult to implement. And if there's any cutting of costs and so on, it's going to be very difficult for physicians to deliver the care, especially family practitioners who are in a situation where they have to take care of both Medicare and Medicaid, both of which pay very low. In fact, Medicaid for the public is actually, at least now, 93% of Medicare, which is actually below Medicare costs. So going forward, we've got what we got. It's passed by the House, the Senate, the governor signed. Now, under the situation we're in, with a 10% plus inflation rate, no matter what they do, that's going to become almost untenable to all healthcare professionals and healthcare delivery systems. It's going to be very difficult to implement. So OSMA at least was against it because of the concept of getting between the doctor-patient relationship, which is what it does. And that's the sole purpose of it. But having done that, now we what's some say in how it's going to be implemented, rates, so on, especially how we get reimbursed, how easy it is to get things done, to get procedures done without too much hassle, and payment in a reasonable amount of time, which Medicare does. Medicare is very good about that. And that's why doctors see it, because they get paid quickly. So we got to have a system that gives that those dollars back to the physician, because otherwise you can't run an office. And even a hospital system is going to face the same situation. So I guess in the summary, we were against it for philosophical reasons, which I think are valid, but based on the fact that the money is the money, it's impossible for the state to turn that down. Now, who knows going forward whether that money will always be there or not? You know, that's a question for a later date. But in any event, that's kind of how we are now. And so going forward, it's the devil within the details about how this happens. My fear is, and we talked about this, I think Representative McEntire and I discussed this. I mentioned the inflation. Now, it wasn't quite as bad as it is now. That was some weeks ago. And, I lived through that in the late 70s when I was president. And it became very difficult to continue to train in Houston. I was in Houston, and the inflation rate was about like it is now. And so that is going to be a huge problem. My personal view, and we don't have to get into too much macroeconomics, is that I don't think, well, you mentioned that the legislature might be making a political mistake and not dealing with tax issues now because people are hurting right now. I think it's the same situation as the Federal Reserve. The Federal Reserve is so far behind the curve that I don't see how they're going to be able to stop this. They would have to raise interest rates over 10%. And if they do that, you know what's going to happen. The economy is going to collapse at that kind of rate. But that's the only choice they've got. Otherwise, you don't have real rates of return. So again, from a medical standpoint, and this is going to be true everywhere, can we get staff? Can we employ staff? We already have operating rooms that aren't filled now. We have a lot of nurses who are traveling around from facility to facility because they get paid more to do that, which is not the best healthcare. That's not the best way to have healthcare. Having nurses who don't have any follow-up with their patients and don't know who their patients are from time to time. That's not the best model, but that's what's happening. So again, that's enough for now. But I think that's kind of where physicians stand and where OSMA has been.
I think what's real important, and I'll let you talk in just a minute, Representative, but I think what the bottom line is, and I'm older than Dr. Holden, and I saw it before, and that is that to save money, which is really what managed Medicaid is about, there's only two ways to save money. One is decrease reimbursements. The other is decrease services. Both lead to a problem with access to care. If you decrease reimbursements, doctors don't have to take Medicaid and they fall off the program, which is what happened in past history. If they decrease services, it doesn't matter that the doctor orders a test or a surgery. If insurance won't pay for it, it still doesn't get done. Both are poor examples for patients, and the patient ends up hurting. So I don't see how this is going to be any different, but Representative, go ahead. What was the legislature's?
Well, I think that the other side of the coin, and I know this is a pro health show, and I'm here with two doctors. The other side of the coin is there are a lot of unnecessary tests. There are a lot of unnecessary scans, and there's overutilization in the ERs. That is a lot of cost that we can rein in. The goal of managed care isn't to depress doctors' salaries or make their lives terrible. The goal is to contain those costs. And it is not necessarily, look, anybody who thinks you can save money in healthcare, they're delusional. You cannot, the cost just keeps going up and up and up and up and up. So as a state, with me as being overseeing this budget, I want to have some budget certainty. And with the rising cost of healthcare, it's very difficult to have any budget certainty. So a managed care, the proponents of it would say a managed care scenario gives you a capitated amount of money. You have only so much money, and you give that risk to providers. And in this case, I tried to protect providers in every way that I possibly could when drafting this, and even allowing provider-led entities to get involved in this. Now, that's very difficult to do. I get it, but I want, and we're trying to keep as much of the money here in the state as we can. But I mean, I think if you keep those things in mind, that's where the other side is coming from. And for, you know, if I put my politician hat on, that's what I'm going to say. But can I say again that we're probably both right? And and this is a new model. It's changed. It's one that failed back in the 90s. And I mean, I've read that Mathematica study. I know exactly what happened. That's why I never really liked managed care. Um, but you know, if we can get some doctors in thinking that, you know, it's the quality of my care, it's not the quantity of my care. I mean, I think both of you guys are probably great, and you don't over care for people, but there are other people out here who do that. And so, waste, fraud, and abuse does not happen at the patient level, and I want everybody to understand that. It's not the deadbeats; they don't get a check from Medicaid. The fraud happens where the money changes hands, and that's between doctors and other providers and OHCA. That's where the fraud generally occurs. And you know, it's a new model. I'm not convinced managed care works. The governor wanted this. I had a job to do. I was tasked to do this, and I did everything I could possibly do to make sure our hospitals and providers were taken care of. 11% of OHCA spend is supposed to go to primary care doctors. And we are trying to move patients from the ER to primary care. And we actually put that in as a goal, as a requirement actually for OHCA. You know, in a certain amount of years, they have to spend 11% of that on primary care. So that's what we're trying to do, get people in to see their primary care physician, have that relationship so we can increase the quality of care.
And I, as speaking as a physician, but knowing the sentiment of many physicians, thank you for all the work you've done over the last several years that I've been involved in the political spectrum. And you have always looked out for the medical community, and I thank you and I appreciate it. And I don't disagree that there is waste in medicine. Dr. Holden has seen, as well as I do, everybody who comes into the ER gets a CAT scan, whether it was really needed or not. There's all kinds of tests that probably aren't needed. But we live in a litigious society, and all of that came about because of the lawsuits. So until education of patients and legal reforms in medicine come about, I don't blame the doctors for ordering excessive tests that they say, I already knew the answer, but I needed the test to document. And I think that's a lot of what happens. And I don't know that we're going to cut a lot of that out.
I just want to ask you a question because that just dawned on me. So you just said that. So let's say a doctor is practicing medicine more defensively because we need some more tort reform or whatever. I mean, wouldn't an intermediary there to get a prior authorization for a test and they were deny it, does that absolve you from some liability? Or does it not?
No.
I'm just curious.
It really doesn't absolve us from liability. And the problem with getting prior authorization is if there were qualified physicians. So when Dr. Holden sends a case for an orthopedic surgery and it gets declined by an orthopedic surgeon with expertise that he can then talk to, that would make sense. But that's not what happens. What happens is our offices call, we're left on hold. I've been on hold for as much as an hour, just waiting for somebody to answer the phone for me after the receptionist answered. And then most of the time you get a nurse or a PA. You don't get a physician. Or I've had psychiatrists, giving me approval or not on GI issues. It makes no sense. David, do you want to weigh in on that?
Sure. The number one complaint at McBride Clinic right this minute with my orthopedic partners is the pre-approval process in insurances. Now, not just Medicaid, but all of it.
I get it.
And first I admit there are obviously some abuse in the system. There's overuse. ordering more tests than necessary. Let's face it, just illegal fraud and so on and so on. That's always going to be the case. But I think that's a minority. I can give you so many examples. Larry, if I got an orthopedic surgeon that I can talk to in that pre-approval process, we almost always agree, and I get my procedures done. But I get so many other people who have a list of things that have been set out by the insurance company that you have to meet those approvals or those factors, or else they deny it. For example, and I just go on forever, but here's an example. A workman's comp case. Guy injures his shoulder. Now, you know how that goes. You want them back to work as fast as possible. I can't believe it's workman's comp. But so the guy injures his shoulder. I'm looking at him and I'm going, you've got to rotate a cuff tear. I know you do. On my exam, I know it. I don't know how much it is. We need to get an MRI so we can decide, do we do surgery or not? Denied. 8 weeks of physical therapy. I go, well, what's that going to do? I mean, that's expense out the wazoo. And then we're going to wind up doing that anyway when I have to do something about it. Then the next patient comes in. I said, you know what? I've been at this long enough. Yep, he's a young guy. He's got a rotator cuff tear, and we got to fix it because you're young. And it really doesn't matter what the MRI says because we got to go in there because I know it's torn. Denied. Got to get an MRI. I go, wait a minute. You just told me I don't need an MRI on the last one, and now we have to have an MRI. And then, of course, then they just you can see where this goes on every single case. That's why the specialists, my partners, are going nuts over that system. And that's what we were talking about before, about moving cases along, moving procedures along, tests that we want to do, and not get bogged down in that. Because if that happens, I can tell you what's going to happen. No one's going to see Medicaid. It's like workman's comp. When the state wanted to push for for lowering workman's comp rates to Medicare levels, I laughed so hard I could hardly stop. I said, well, you go right ahead and do that and see how many people see it, because it's just too difficult. And so, of course, they realized, well, the state chamber. And yeah, I get it. More business coming in, lower healthcare costs. Let's do it. And then they realized there'll be no delivery of healthcare to workman's comp if that happens. So it's sort of the same thing here. Again, this is where the managed part gets in, and I wish I could say that every doctor was great, every doctor's perfect. They're not, and I get that, but I think in the end, what happens is it bogs the system down. And again, what the doctor's going to do is just not see it, because that's time, effort, staff. My staff is calling to set up a phone call in the middle of the day to get this done with someone I have no idea where they are in the United States. And so that's time and effort and staffing that we have to do, and that becomes a problem. And so that's why most physicians' offices will have a pie shape of what they see, Medicare, Medicaid, Blue Cross Blue Shield, whatever, and they watch those pies and make sure that one of them doesn't get too big, because they know where they are. If they do that, they're not going to be able to continue to function. Again, this is all about, again, like you say, you have coverage, but you don't have care. You've got to be able to deliver the health care. You've got to be able to pay the costs, and staffing is the number one issue right now. Of course, as any business is, the personnel and labor is always the number one cost in the business, and that's where all physicians are right now, and all of healthcare is right now. Getting the staff, we got to pay them.
Well, and when you say coverage and care, they sort of go hand in hand, because if you don't have the physicians, if physicians drop out of the programs, then you don't have access to care.
No,
and
exactly.
Oklahoma is already in a shortage of physicians and nurses. Our rural hospitals are hurting, and the last thing we want to see is physicians dropping out of the Medicaid program and hurting access to care. The rural hospitals absolutely need those patients. And so, we've got to, if the legislature, my opinion, if the legislature is going to pass this, they need to have oversight and see what's going on. And they need to regularly, frequently talk to the doctors, talk to Dr. Holden, talk to the osteopathic leaders, talk to the doctors who, have the wisdom, the experience, and are sort of middle of the road, not extreme on either way, and find out what's really happening out there before the patient gets hurt.
Yeah, and we're still 2 years out from this thing probably even happening. And so, I mean, it's going to take a long time for OHCA to get it up and going. I mean, you have different hospital groups or whatnot wanting or desiring to be provider-led entities in this managed care system. And by the way, it's unlike any other state. There are, if you've seen one Medicaid program in the United States, you've only seen one, because none of them are like one another. But it's a ways down the road. I am sure next year we're going to discuss some tweaks to it before it even starts, and we'll just see where it goes. I mean, this thing is a long way down the road from happening. Yeah, it's been signed into law and all that, but there, like Doc Holden said, the devil is going to be in the details in this. And if providers don't have a say at that table, you guys, OSMA, Hospital Association, all primary care doctors, all of them will rise up and they will let us know. I mean, we don't even have to talk to you, because you guys let us know, and we'll find out how it's going. I mean, people love to tell us stuff, and so we'll find out about this really quick, and we'll have to probably move some stuff around and make some tweaks, and we'll probably be tweaking it for the next 20 years if it lasts that long.
Larry, I want to reiterate that after speaking with you on several occasions, Representative, I know that you're a friend of medicine, and we appreciate everything you do. And I know where you were on this. I mean, you kind of said it basically, that this is going to be coming down the pike, and so and you did your best, and I appreciate that. I mean, we don't have an issue there. Which you can see when the steamroller's coming. It's which side you're going to step to. That's about it. Or get run over. So, anyway, so I just want to mention that
hard to say
and
no
I want
to.
everybody to know that. I just want everybody to know that I wasn't talking bad about doctors. There's always bad apples in every profession.
Nobody.
Absolutely, we all agree with that, and it's hard to say no to $800 million. So
it is.
Yeah,
mm-hmm.
Yeah. Well, I want to move to the next topic, and that is legislation on some of our gun bills. We've all seen what's been in the news. We've all seen the mass shootings. We've all seen what happened in Uvalde. We've seen what happened in Tulsa. And I've heard for years now, you can't take guns out of 18-year-olds. It's their constitutional right. And I understand what the Constitution says. I've actually read most of the Constitution, which I'm not sure all the legislators have, but the Constitution was written to allow arms. They were talking about single shot muskets, not AK-47s or AR-15s. And they were for defense of the country, because we didn't have a big army, which we do now. We have a National Guard. They were to allow people to hunt for their food, which you don't do with automatic weapons. Nobody's turkey hunting with an AR-15. And so I think there's a lot of misunderstanding of what the Constitution was meant to be and what we're actually doing with it. And now we're talking on the federal side of letting each state sort of make its own rules. So we're not even going to have consistent rules in this country. I'd like to know really where you're at, Representative, where you think our legislature's at, although I think I know. And do we have any chance in this state, not the federal government, but in this state, of having any reasonable laws passed to avoid mass shootings?
So, you look at what the feds are doing right now, and they're talking about red flag laws and, lower capacity magazines. I mean, there's already millions of higher capacity magazines out there. And I want to correct you, AK-47s, I think you have to have a special license to have them, if you can even get them. AR-15s are very prominent. I get the whole rationale behind the lower capacity magazines. If somebody's in a mass shooting event, if their cartridge only holds 8 bullets, then they're going to have to stop and reload, and maybe somebody can intervene and all of that. You know, this is one of those things that, you know, if you talk about polls and stuff, people really want to do something about this, but yet when you start drafting bills to maybe try to deal with it, then people fall off. And the devil is in the details. A Democrat running a red flag law would never work here. I really see that Oklahoma probably wouldn't be prone to pass one of those until one of these heinous criminal acts happens here. And it is a hard issue, and people don't understand the pressure. You know, when you're in that building and the pressure from lobbyists, constituents who are mad, and things like that, and they're on both sides. It is like emotional warfare on us when one of these type of bills even come up. I do agree. I don't think that we should have a federalized rule on this. I believe that states should be able to form their own. All politics is local. I'm really consistent. I don't like the federal government impeding on the state, and I don't like the state impeding on local governments. And I try to be really consistent on that. I just think that you will have, just like when Roe v. Wade, it looks to be overturned, you will see a similar patchwork of states with similar laws and some that ban it and whatnot. And it will all depend on where you live. But, you know, those politicians that you know won't vote for these things that the people want, if the public sentiment changes, then they'll elect new people who will do what they want. But yeah, it's a political process, and there's no easy answers. But these mass shootings are so hard to predict, just like trying to predict suicide. And I read a really interesting article the other day that almost all of these male mass shooters, almost all of them are male, all of them had either contemplated or tried to kill themselves. And they were choosing between, do I kill myself or kill a bunch of other people? And maybe they'll kill me in the process. This is a mental health issue. Guns do definitely play a role, but this is a mental health issue, and we've got to be able to intervene when somebody makes a threat like this. And I mean, because some of these kids could have been caught. And Florida actually has a red flag law right now. I think that they've invoked like 8,000 or 9,000 times, and it's prevented some disasters. So I think that there could be a red flag law. If you just say that word to Republican circles, they freak out. But I think there could be a really conscientiously drawn up red flag law that would allow some intervention when a legitimate threat is made.
Larry, I had a lot the other week. I had a lot of interviews concerning the disaster in Tulsa, and of course that was orthopedic surgery, sports medicine, close to my heart. One of our own members, and so people have been asking me about safety in healthcare and in health facilities. From a historical standpoint, the healthcare profession may be one of the most underreported of all violent situations in the workforce. And it has been that way for years. Dating back to the 70s, when I trained at Ben Taub County General in Houston, there have been violence in the ERs. There have been shootings. I looked it up. There's a couple of shootings in South Carolina just a couple of years ago. This has been going on for a long time. They estimated one time at Ben Taub General, 30% of the people that walked through that ER were armed. Because there were a lot of illegal aliens who had no recourse with the law, and so they carried weapons all the time. So that's always been the case. Nurses have taken the brunt a lot of verbal violence, a lot of verbal abuse, physical abuse. That's been going on, unfortunately, unreported. We have passed a law in Oklahoma just in 2020 about making that a significant crime in the healthcare system. So it's always been the case. Obviously, the number one thing you can do is what they did in Houston, and that is, every facility, it's going to be an individual facility situation. Each facility is different. One problem with medical facilities is they're complex. Multiple entrances, multiple exits, multiple corridors, elevators, stairwells where people can move back and forth. So what happened is you couldn't get in and out of the facility down there without a badge. They had to know who you were and if you or why you were there. and the numbers were limited. We had nurses that were raped in the stairwells and so on. So that's not a new thing. This is unfortunate that it's hitting because of all the other mass shootings. I just want to mention that that's not a new problem. And again, going back to the gun issue, I'm not going to get too much into that, but it does remind me of a situation, and I've always thought this since I'm a historian of World War II. It's very difficult to stop someone who's willing to die. And you mentioned it right. Most all these guys wind up either killing themselves before the police ever get there. And they obviously had no intent to leave or get away. And that's hard to stop. Once you have that, and therefore, they'll use whatever means necessary to accomplish whatever's driving them, whether it's capturing a car and smashing through people, knives, bombs, whatever. They're determined to do something, and they're going to figure out a way to do it. So yes, I mean, obviously, and let me just mention, by the way, this is always a fun little topic for me. People talk about AR-15s, AK-47s. The definition is between a semi-automatic rifle and an assault, a battle rifle. A battle rifle is a fully automatic weapon that can fire full auto or semi-auto. A semi-automatic rifle is whatever. AK-47, semi-automatic, AR-15, semi-automatic. They're semi-automatic. You have to pull the trigger every time. Now, that's not true of a battle rifle. Now, of course, battle rifles are Class 3 weapons. You can't own those. Almost no crimes are committed with a Class 3 weapon. They just don't happen because they're too strange.
Yeah, I just think that you have to understand many Oklahomans are ardent Second Amendment. They want to protect the Second Amendment. I mean, I've got 100%. I've got 100% voting record with the NRA. I mean, they've endorsed me. We have to beef up mental health. And people in Oklahoma, they do love their guns. I mean, I like my guns, for protection, for hunting, for whatever. We're talking about, I understand your argument that you started with, Dr. Bookman. If you look at when the Bill of Rights was drafted, and I get it was a different time, but we still have that right. And there are people staunchly protective of it. And I'm pretty staunchly protective of it. But I do believe that, and it's not necessarily a red flag law, but there are some things that we can do as a state to prevent some of these things. And if they're thoughtful and they're well drawn out, we can do this. The problem is you hear, everybody hears in media, and it's just the talking heads who will never agree on anything. We really need to have deep conversations about these issues, because these were little kids and that were just senselessly murdered. And in Tulsa, that wasn't a disaster. It was a heinous criminal act. Now, it's a disaster that came out of it, but these are criminal acts, and they are against the law. We already have laws on the books that are against these things, but my heart does go out. And I just think that there are some things that we could do, and they could be really not huge things that would freak everybody out, but we've got to get them there. But if you start even dabbling around the edge of the Second Amendment or trying to restrict something, all holy hell will rain down on you as a politician, from the lobbying side, from the constituent side. And I know where my constituents are on guns. And that's why I have 100% in our rating. I represent my constituents on this.
Well, and I am a gun owner, and I staunchly defend the right to own guns. I do not own an AR-15. I do think Florida has passed, it's a Republican state, a Republican governor, but it has passed reasonable laws. And Connecticut is another state that could be looked at. And we could get some reasonable laws without restricting the right to own guns. Nobody's asking for that. What we're asking for is reasonable gun laws. And we could look to other states for those reasonable laws. And I would hope that, we would look at that. I would hope we won't wait until there's another disaster, whether it's in Oklahoma, Texas, Kansas, it doesn't matter to me. Innocent lives and children being murdered is just not acceptable. So,
Well, and I get it. In all of these cases, almost all of them, the shooter threatened it. In almost all these cases, they threatened it as either a cry for help or
right.
whatever. They threatened it. But we have to, as citizens, when we see those threats, we have to report them. And
Absolutely.
you just, I mean, there's this rat. There's no, I'm not. I was going into college professor mode, and I'm going to get out of it real quick. But I mean, but people don't do that a lot because they think somebody else is going to do it. It's called rational choice theory. And if you see somebody making a threat like that, you need to report that.
Absolutely. David, you had something to say?
Well, I was going to say that, we've all lived long enough, Larry, to see that, back in the 50s, 60s, if something like that Texas Tower shooting occurred, it was on the news for weeks. It was so shocking. And I will remind everybody that was a trained military marksman with a bolt-action rifle, and he was the most deadly mass shooter of all time because it was almost one bullet, one kill. He was an expert at it, and it didn't matter that it was a bolt-action rifle. He was the most effective, maybe, guy in the last 50 years. So, again, unfortunately, I think it's the mass breakdown of society in many different ways. There was a time when these things, you just didn't do it. It was common knowledge. No matter how crazy you were, no matter how much mental health you had, you just didn't do this. We all took care of people in the psych ward and so on and so on. This was not something you really worried about. So I think you just see society itself breaking down. And again, the use of whatever. Heck, I think about the woman that drove her car through the parade in Stillwater. The drunk guy that killed all the cross country runners in down there in Norman, and those are horrible. Again, there are other circumstances, but still, some other weapon was used to kill people. So I think, again, it's like, say, mental health, but it's also a fragmentation of what's okay or what's not okay. But there was a time when these things just weren't okay, and people realize that that's a tough nut from a legislative standpoint. How do you legislate that? How do you deal with that?
And I'll close this particular point with mental health is also an issue in Oklahoma, and we need to put more emphasis and more money into our mental health. That's been talked about over and over again, especially in the last 2 years with COVID. Mental health has become a real big issue, and we need to address it. We can't just turn our heads on it. So I agree.
We've been investing in it. We've been investing in it too. Yeah.
Yeah. So, it's a big problem. And it's not going to be solved with one simple answer by any means. And it's not going to be solved on this program, but it does need to be talked about. So
it does. And without yelling at each other.
Yeah.
I think the internet's been an issue too, where these people act out these things on the internet and then they go do it. And there's no inhibition in them being able to fantasize these, work them out in their head, then go do it too. So, I mean, obviously the internet's not the sole problem by any means, but it's certainly an issue where they can rationalize and think it out and so on. It's just something we didn't have before.
And
we've got big problems.
Yeah. And part of it is the breakdown in society. The last thing, I just want to spend a very short time. We're actually at the end of the hour, but I'd like to just bring up one point. And you brought up about abortion, and that's obviously a very complex issue, difficult. The legislature has passed some of the strictest abortion laws in the United States. Was there any discussion on rape and incest that by the laws passed when a young girl, and I know of a specific example of an 11-year-old who was raped and is pregnant, and by our laws now would have to carry that child and it's not, the woman's not in any danger.
Well, no, the thing is, if they report that to the police, I believe it's reported to authorities is what it says. I've always been one to want exceptions for rape, incest, and life of the mother.
Life
And
of the
yeah,
Mother is in there, but I
maybe it's
didn't.
not rape. Is it
Yeah.
incest? Maybe it's incest in that. It wasn't. It look. We didn't get an opportunity to amend that bill. That bill just showed up, and
Really?
yeah, it was thrown on the floor, and we didn't know it was coming. It came. I didn't know it was coming, and it came, and whether it wasn't whipped or anything like that, it was just thrown on us.
Does that happen very often?
Yes.
No. Okay.
Larry, I was going to say that from an OSMA standpoint, we weren't really involved on some of those bills, except for the one that would criminalize a physician or a healthcare provider performing an abortion when it is considered a legal procedure or not a criminal act by the federal government. We didn't see that somebody should be prosecuted when it's considered legal by the federal government. Now, and that fortunately, didn't go through. But that's the only thing we as an organization weighed in on, was that particular aspect. It had nothing to do with whether we were pro or a con against abortion. It was just, don't criminalize an act that's legal, on the federal level. So.
I want to clarify. I mean, I believe that we were told that was going to be on the floor that day. I believe we were told it was going to be on the floor, but we didn't get a chance to talk about it in great detail in caucus that I remember.
Is it something, and I'm only talking about rape, because that is not a victimless crime. That has a victim. And while the man may be prosecuted, the woman has to carry that the rest of her life, because at least when I read the bill, rape was not included.
You may be right. I need to go back and read it again.
And if it's not, then, is that something that needs to be revisited, or could it ever be?
I think it could. I think it could be. All it takes is someone to draft that bill and file it and get it heard, okay. Which might be really difficult.
Okay. Well, we've talked about some very difficult topics, and I personally want to thank Representative McEntire for taking his time in an election year. And
I hope I didn't just sink myself.
And being on the hot seat, I want to specifically say these are his opinions, not the opinion of the governor, of the legislature, but he is a very highly respected member of our House of Representatives, a friend of medicine, and we invited you on because you are reasonable. You're not an extremist either way, and we appreciate that. It's somebody where we can talk, not yell, not scream, and not make threats, but talk about difficult issues. And these are all difficult. I don't pretend to have answers. I don't pretend that it's a simple solution for any of it, but it is something where medicine and the House of Medicine, which Dr. Holden represents at this point, needs to be involved with the legislature in all of these talks.
And for me, my personal opinions are really irrelevant to me when I'm voting, because I vote what I believe my district wants, and not necessarily, people say vote your conscience. I don't do that very much. I vote the way my district wants me to vote. And some of my friends don't like that. And I get it why they don't like it, but I represent my district. I am very serious and very sober with that.
And we appreciate it. And Dr. Holden, I appreciate you taking time out of a busy schedule. I know what it's like as president. You're called on for a lot of things as well as private practice. So thank you for taking this hour, and hopefully we'll have you on again.
These are difficult topics, and there's no easy solution. And they've been building for years. This is not, like I said, in terms of healthcare, they're not new. No. Maybe the level is a little bit different, but it's been going on for a long time. Nothing's really changed. It's too bad it's been unreported in medicine.
Yeah. Well, thank you both. It's been a fun show. The hour went quickly. Scott, I didn't get to any questions. If there are any, we can spend a few minutes longer if
We
Dr.
just had
Holden.
Julie and some others saying hello. And I did want to
Okay.
say this because Dr. Holden brought up Charles Whitman,
Yes.
1966, University of Texas, that observation tower there today. Charles Whitman killed his mother and his wife with knives before he went to that tower. We heard anything about killing a loved one before they go on one of those tirades. Had been abusing methamphetamine, so had an addiction problem. Is that in the news? I do want to say this, Dr. Bookman, to close it out, that this weekend, it was my pleasure today to be up the Greektown Ballpark where I was spent some time with the folks over at the Oklahoma State Department of Mental Health and Substance Abuse, specifically Jeff Dismukes, who is the followers of this program, sees a lot, where I did an interview with Gary Mendel, who's the CEO of Shatterproof, who's one of those organizations, nonprofit, that's helping with addiction. Marcus, you've probably heard of Shatterproof. They're now working on being able to identify not only for people to get treatment from really good agencies, but also working on stigma, because the data is now saying, hey, you can work miracles with rehabilitation, but you've got to deal with stigma. If people feel bad about themselves, both Gary Mendel, the other guest is Reggie Whitten, well-known lawyer here in town. He tried those opioid cases. Both of these gentlemen lost their sons to addiction. And so we'll have that, I think, Saturday, Sunday on News 9, News on 6, that Father's Day special. It was a hard one to do. It's a hard one to listen to the stories. So he will introduce some folks to that idea. I believe that Gary told me today that 27% of people just really don't believe in addiction at all. Just don't think it's a real thing in this country. It's a lot of work to do. Dr. Bookman, it's great to have you back.
Thank you.
We've seen Representative Marcus McEntire. The future is uncertain, I guess, for at least the special sessions, plural. And Dr. Holden, Dr. Bookman just alluded to it. There's no rest for, you're running a business, doing surgeries, doing what you do, and then having to deal with politics. Oy vey.
Well, that's why I'm here. And I've spent my whole life just working. And now I thought, maybe I better get involved a little bit. So.
And I will say that I had a small part to do with getting Dr. Holden to this position. So
small part, you know what? You got me in this mess. So.
Well, he's only the best communicating president OSMA ever had, and look, he's still here. I mean, he's been it's like 3 years since he was president of OSMA, and we just can't get Dr. Bookman off the air. And when we do, he's in Switzerland, quarantine, and people are going, get him back over here. So, message received, and we'll be seeing you again. All right, we'll see you this weekend on TV. I think we're going to be having a really great Father's Day weekend with some content you haven't seen before, and we'll be looking forward to seeing that. So, Representative McEntire, Dr. Holden, Dr. Bookman, and to our viewers, News 9, News on 6, and Ryan Wilton back at the station putting this all together. Thanks once again. Have a great evening, everyone.
Thank you.